Tubal factor infertility is disease or damage to the fallopian tubes that can account for upwards of about 25 to 35% of infertility cases. There are several causes of tubal factor infertility. Endometriosis can lead to tubal disease. Pelvic infections, most notably gonorrhea or chlamydia, are common causes of tubal disease and obstruction. Previous pelvic or abdominal procedures, such as an appendectomy or other bowel surgery, or women who've been operated on for fibroids. In addition, women who have undergone a previous tubal ligation have tubal obstruction, and that falls under the category of tubal factor infertility. Any disease state that causes damage to the fallopian tubes can compromise fertility. The insides of the tubes are lined with millions of hairs called cilia, and any damage to these small hair-like structures that are responsible for moving eggs and embryos can compromise fertility. So even though a tube may appear normal from its exterior surface, there can be damage on the inside of the tubes. Some types of tubal factor infertility are avoidable and others are not. Infections as a cause for tubal factor disease, tubal factor infertility, can be avoided through barrier contraceptive methods. So although oral contraceptive pills and other forms of contraception may prevent pregnancy, only condoms, which serve as a barrier method, can decrease the transmission risk of getting gonorrhea, chlamydia, or other sexually transmitted diseases. The diagnosis and treatment of sexually transmitted diseases, most notably gonorrhea and chlamydia, if caught shortly after exposure, can limit the damaging effects of those diseases to the fallopian tubes. It's very important that sexually active women, even those not considering pregnancy at the current time, meet with their gynecologist regularly and seek out treatment if there's any suspicion for infection. The increased use of minimally invasive surgery performed by gynecologists and general surgeons over the last few decades has greatly reduced the risk of adhesions forming following surgery. In the past, many pelvic and abdominal surgeries were performed through what is known as a laparotomy, which is a large incision. But now with laparoscopy and other minimally invasive surgery, pelvic and abdominal procedures can be completed through the use of small incisions, often measuring less than a centimeter in size. Patients are able to go home sooner after surgery, often the same day, and the risk of scar tissue forming is greatly reduced as compared to the larger, more traditional laparotomy procedures. There are basically two treatment options for women with tubal disease: tubal reconstructive surgery or IVF, in vitro fertilization. Tubal reconstructive surgery has a very high failure rate when there's extensive tubal disease. It has very good outcomes, though, for women with minimal disease, minimal adhesive disease, or minimal tubal disease. With IVF, the fallopian tubes are bypassed, eggs retrieved from a woman are fertilized with her husband's sperm, and the resulting embryos are placed back in the uterus, bypassing the fallopian tubes. Tubal reconstructive surgery has fewer indications now in the current era of IVF and other assisted reproductive technologies. In regards to women who've undergone a previous tubal sterilization, most practices recommend IVF over tubal reversal surgery.